Thank you for staying with us. You may not be aware, but June happens to be Stroke Awareness Month. And in the studio with me now from the Senior Support Services, I'm talking with Jennifer Godkin. And she happens to be recreational therapist as well as a health promoter. Did I get that right?
You did. Thank you for having me, Doreen.
Hey, it's our pleasure. It's definitely our pleasure. So, Senior Support Services, you have they have a support group, do you not?
We do. We offer several support programs for stroke survivors in the community. So after they've been discharged from hospital, we have things like monthly support group meetings. We have aphasia conversation groups. We run between Perth and Brockville. So we're pretty busy. We do a lot of education as well. So we have a couple of regional education sessions that we run each year. So we're providing a lot of support to stroke survivors and their caregivers.
It sounds like you are. So what is a stroke?
So some facts about stroke first is usually a stroke happens because there's been a blockage, which is an ischemic type of stroke, and then or there's a bleed in the brain. Okay. So it restricts the blood flow from going to different parts of your brain. So that is really what a stroke is and how it happens. There's several people that have strokes each year, so about 1 in every 5 minutes someone is having a stroke here in Canada.
Really?
Yes, and it's also the leading cause of disability and death in our adult population, so in Canada.
Is it because people, if they have a stroke, I mean, like minutes, seconds, it's very important for a person that's having a stroke, right, to get medical attention?
Yes, so time is brain. That's a big, a big saying for us in the stroke world. So we're here to advocate today. I want to make sure that people are aware that time is brain. So there's things that you can do to react by knowing the signs of stroke. So we have an acronym called FAST, F-A-S-T. The F stands for the face. So that is the facial expression if someone's drooping on one side or you notice their eye is sagging. That's a pretty good indicator that you should call 911.
Is it usually the whole side of the face, or could it be just one or the other, like the mouth or the eye?
Yeah, it could be just one or the other.
Okay.
You could ask someone to stick their tongue out if it's hard to do. You'll notice a significant facial drooping on one side or the other. That's a pretty good indicator. So F is a very important one. Then we have A, which stands for arm. So if you're suspecting that someone's pretty vague, they're not responding to you, you might ask them to raise both their arms, and one side might significantly drop, or the individual might not be able to lift that one side when that request is made.
Alrighty.
All right, the next one is the S.
Yes.
So that stands for speech. If someone has very slurred speech, if they're kind of marbled and sounding like they're talking with a mouthful of marbles, or they're not making coherent sense of a sentence that they're saying,
yes,
that's another really huge indicator.
Okay.
And the T stands for that time piece. Time is brain. So every second there's thousands of brain cells that are affected. So we want to get them help as soon as possible. So we're saying if you see any of those signs, if you suspect anything, the best thing to do is to call 911.
Okay.
That's your first stance. And it's really important, especially now in the Brockville area. We have a new stroke protocol that the Brockville General Hospital launched back earlier this year. And so they have a whole stroke protocol now where they're able to dispense a drug called TNK, which is a clot-busting, life-saving drug. But information is really important for that to happen. So you need a CAT scan very quickly. You need someone to read those images to make sure that that is definitely a clot.
Right.
Because this is a clot-busting drug. So it'll break up the clot that's causing the brain.
But you have to know where it is.
That's right.
Okay.
So you just need to have confirmation that it is a clot, because if it's a bleed, this drug would make you bleed out more. So it's a very safe thing. So they have a new program where an ambulance driver will call ahead. It flags a stroke protocol, so they'll call code stroke in the hospital. I've been there when one's been called. And there's a whole emergency team that embarks on this one patient, this one room. So 7 to 9 professionals from a social worker, physicians, They make sure the CAT scan has been cleared so that the person can quickly get into the machine.
Yes.
Because the drug is really remarkable. It's had some great advantages with minimizing stroke or being left with no residual effects after your stroke. So it's really important for that timepiece. It does help minimize exactly what can happen after a stroke. Because as we know, there's many disabilities that can happen from a stroke, such as physical disabilities, the inability to move one side or the other of your body. There's cognitive issues that can happen, issues with speech, which we class as aphasia. So the ability to read, write, communicate can be affected, the social, emotional well-being of a person, and it impacts the whole family. So it's not just a little thing. So our hope is to prevent and to acknowledge that stroke does happen. It's continuing to happen, but if we can educate more people in the community so that they can react quicker to help prevent these sort of lifelong disabilities or inabilities moving forward. And also, stroke has no age. You know, we used to think that it was like an older generation that had a stroke. But honestly, young children can have strokes. Adults can have strokes. Seniors can have strokes. It's not really specific to male or female. It's not. But there are some stroke factors that you can look at to help improve your lifestyle, to help prevent one. So a lot of what we do is stroke prevention. So things like knowing that healthy eating can be really important. A low sodium diet, if you're obese and have issues with weight, you know, getting that under control. The amount of alcohol you can consume, you know, making sure, you know, we're not saying don't drink or don't have a drink with your friend, but definitely minimize the amount of alcohol that you're drinking to 1 or 2 drinks. You know, that's important. Exercise is extremely important in stroke prevention. So if you know, exercise well and you do some of those things for yourself, it can all help to lead to a healthier lifestyle, which would lead to no longer having a stroke. We can't control some factors, things like if you've had a TIA, if you had a minor stroke before, your risks are a little bit higher for having a stroke. Things like diabetes, you know, those are risk factors that, you know, are sort of out of our control. They're health factors. Atrial fibrillation is another cause for having a stroke. So those are some things that are a little more difficult. Your genetics, right? If you have
control over that.
Hypertension. Those are some things that are really to be mindful of, to watch out for. So if you're living with a loved one that has some of those things and you notice some of these signs, it's important to react.
So time frame. I'm going back to the stroke is happening. Like, do people have 15 minutes, 20 minutes, half an hour, 2 hours? Like, what is the time?
So initially with the TPA drug that they used to give, it used to have to be administered with sort of a 2-hour window. But now with the TNK, it's a better suited drug that can be given over a longer period of time. So I leave that up to the health professionals, of course. Your doctor will certainly talk to you about the risk factors of having any of these treatments. They also now have a new treatment in Kingston. If we need to get you to Kingston, they make sure that happens. It's called EVT. So actually they go in through your groin and they go up with the scope, sort of like if you're having blockages in your heart. Opening it up. So they actually go in and pull that out, or stents. So there's lots of treatments and they're the professionals. So it is best to get the person to the hospital to make sure they get the best treatment available for them and for their condition. Especially if you're not sure if it's a bleed or, you know, we can't tell, we can't see inside the brain, so that scanning needs to happen quickly.
It has to happen. I wanted to know whether or not, you know, if it was because the time is of the essence, and whether or not it was half an hour, but no, I think you've pretty well answered my question, that you will have time to get to the hospital and have things done, so not to worry about that. So the I think what is important too is the caregiver. After a person has had a stroke, I think it's nice for the caregiver to have some knowledge as to what to look for I know, and how to take care of a person that has had a stroke. And if they're familiar with all of this, it will help them.
Yes. So they're definitely discharged with a great plan. They work with the social worker, the physiotherapist, the occupational therapist. Definitely Ontario Health at Home gets involved with stroke survivors. There's a great connection now with the community paramedicine program for people who have had stroke that may not be connected to a doctor. So they get connected with them so they can do some follow-up checks on them and make sure their blood pressure's still good, that they're taking their medications. You know, if they have any questions or concerns, the community paramedicine team has been great in responding to the new stroke protocol and making sure that people who don't have a doctor, because that's a major issue in many areas, that they're being followed after their stroke. So that's a great peace of mind for stroke survivors and caregivers.
So Jennifer, how this June is Stroke Awareness Month. So what are you doing to either celebrate, bring awareness to the community? What are some of the things that you're doing?
So I have a lot of things going on. Thank you for having me on today. This is one of my big things that I do every June. I think this is our third time that we've done this. I will be on the radio. I know I'm speaking with Bruce Wiley, and I think I'm speaking on the early morning show with Keith, with our local radio stations.
Good.
I have some wellness fairs that I'll be presenting at throughout the Brockville area, especially the Brockville one at the Brockville General Hospital.
Good.
We'll have a booth set up there. I have some fast cards and different things that I'll be able to hand out to people, so they'll have that little card as a reminder that, you know, if someone's having a stroke, here's a little checklist that I can go through. So we'll be handing those out and just promoting awareness through the communities. I'm presenting to the Probus Club to 50 or 60 people, so the more touches I have, the more face-to-faces I have, will promote awareness so that more people are aware of signs of stroke, how to react if someone you think is having a stroke, and just what we have available and to offer to stroke survivors and caregivers in the community through education, through our support groups, through our aphasia groups, and all have become very popular. So we have a great number of people we're providing support. So to celebrate them, on June 24th, I have a stroke awareness barbecue. We've invited people like the community paramedics. We've invited the rehab team that they've worked with at the hospital. And I invite community members such as yourself, the radio, members of parliament, that sort of thing, our board members. So just to celebrate them and their success. We see success throughout the years. I have stroke survivors from 10 years ago, 15 years ago, and some from a month. So we try and celebrate each of them and their successes. And we just bring everyone together and promote them with a barbecue and, you know,
Wonderful. That's nice.
Bring awareness.
Yes, bring awareness.
That's the whole thing, is to make people aware so that we can prevent further strokes and certainly prevent further ramifications after having a stroke, so we can minimize those effects.
Good. Thank you.
Thank you for having me.
Well, it's you're educating. You're educating, and I love it. I absolutely love it. Yes. Yeah. And that's what it's all about, is to prevent.
And we're very lucky in our Senior Support Services agency. I've been told by many people how wonderful our programs are. We have aphasia bi-weekly programs in Perth and in Brockville. We always advocate to try and raise more money or make the government aware that there's a bigger need for that. I currently have 19 clients in my one aphasia group, and I have about 15 in my one in Perth. So there's definitely a need for more support. And we see huge gains in the people that attend those groups.
Good. I'm glad to hear that.
Yeah.
Thank you very much, Jennifer, for coming in.
Thank you for having me.
Okay, don't go away. We'll be right back.